Hello everyone. My name is Rehaan and I'm from Engineering Physics third year. Today, I'm going to talk about electrocardiogram, signal processing, noise filtering, and feature extraction using convolution techniques. So, first of all, what is an electrocardiogram? Electrocardiogram is a medical test used to measure the electrical activity of the heart over a period of time. It provides vital information such as heart's rhythm, rate, and strength and timing of electrical impulses as they travel through the heart muscle. The discovery of ECG was done by the Dutch physiologist known as William Beethoven, who is often called the father of electrocardiography. He was also awarded the Nobel Prize in Physiology or Medicine in 1924. The discovery of ECG marked a monumental step in understanding heart diseases, evaluating medications, and many more, offering a tool that has since become an essential part of modern medical diagnostics. How an ECG works. The heart generates electrical impulses that trigger contraction, causing it to pump blood. These signals can be detected using electrodes, which can be applied on the skin, typically on chest, arm, and legs. The resulting ECG waveform shows distinct patterns, each reflecting different parts of the heart's electrical cycle. So, ECG is used to diagnose heart conditions, evaluate heart medications, and for pre-surgery and pre-exercise screening. So, this is an electrocardiogram trace. This contains various intervals, waves, and segments corresponding to the electrical phase of the heart's activity. First, there is the P wave, which represents the contraction of the atria, which are the upper chambers of the heart. Then there is the QRS complex, which represents the contraction of the ventricle, which is the lower chamber of the heart. This is the most prominent trace. This is the T wave represents the when ventricles recover and prepare for the next heartbeat. And this is U. It's not always clearly visible, but it can represent the further ventricular or repolarization or delayed recovery of the Purkinje fibers. So next we'll go through using convolution techniques for ECG signal processing. Electrocardiogram are critical in diagnosis of cardiovascular diseases. Cardiovascular diseases are diseases related to the heart. ECG signals are prone to various kinds of noise, making accurate analysis challenging. They suffer from noise due to various factors such as muscle contractions, muscle movement, for example, baseline monitoring, and power line interference. So, to obtain reliable diagnostic results, effective noise filtering and feature extraction methods are crucial. Recently, convolution techniques have emerged as powerful tools for signal processing. Convolution can capture local dependencies in the signal, making them suitable for denoising and extraction. Traditional methods for ECG signal processing include wavelet transform, Fourier transform, and adaptive filters. These techniques aim to reduce noise while preserving critical signal characteristics. However, many of these signals have their own limitations. Now, convolution. Convolution describes the relationship between the input signal, system behavior, which is the impulse response, and the resulting output. Convolution combines two signals to produce a third one. One of the signals is essentially smeared across the other one to produce an output. So here, the yn is the output, xn is the input signal, and hn is the impulse response, system's impulse response. Convolution techniques can be applied directly to ECG signals for noise removal. The filtering process involves applying a convolution filter, also known as the kernel, to smooth the signal and suppress noise. Now, after going through convolution, we'll go through convolutional neural networks. Convolutional neural networks are distinguished from other neural networks by their superior performance with image, speech, or audio signals. They have three main types of layers, which are convolutional layer, pooling layer, fully connected layer. The convolutional layer is the core building block of CNN, and it is where the majority of computation occurs. It requires a few components, which are input layer, a filter, and a feature map. Pooling layers, also known as downsampling they conduct dimensionality reduction, reducing the number of parameters in the input. Similar to the convolutional layer, it filters across the entire input, but the difference is that does not filter any weights. Its filter does not have any weights. The fully connected layer, each node in the output layer connects directly to the node in the previous layer. This layer classifies based on the feature extracted to the previous layers and the different filters. Now we'll go through using convolutional networks, neural networks in electrocardiogram signal processing. So the traditional machine learning models often rely on manual feature extraction to classify ECG signals. This requires a lot of time and expertise. CNN, however, can automatically learn and extract important features from the data using convolutional layers, making them ideal for ECG analysis. Now, I'll tell you why CNN works well for ECG signals. They have local dependencies. ECG signals have spatial dependencies, meaning neighboring segments of the signals are related. CNN can automatically learn the relationship by applying filters that slide over the time series. Automatic feature extraction. CNN can capture important features such as RP, QRS complex, or any anomalies without requiring any handcrafted features. Scalability. CNNs can be extended to multi-lead ECG signals, enabling the analysis of more complex conditions with different leads, providing more comprehensive data. Now, 2D and 1D convolutions. ECG signals are 1D, and 1D CNN can effectively process such data. Sometimes signals can be transformed into 2D formats such as spectrogram and analyzed using 2D CNNs. Now let's talk about the architecture of CNN for electrocardiogram analysis. The typical CNN architecture used for ECG analysis includes multiple layers. So the first layer is the input layer, which is the raw ECG data processed as signals. Then there's the convolution layer. The convolution layer applies the filters to the input data. In case of 1D ECG signals, the convolution operations will slide along the time axis. These layers learn from filters that respond to different signal patterns, like R peaks, QRS complex, and other morphological features. Now, activation layer. After convolution, a nonlinear activation function such as a rectified linear unit is applied to introduce nonlinearity and help the network learn more complex patterns. Uh, then there is the pooling layer. After each convolution operation, pooling is applied to reduce the dimensionality of the data. Pooling helps make the model computationally efficient and reduces the chances of overfitting. Then there is the fully connected layer. Once the convolutional and pooling layers have extracted relevant features, the data is flattened and passed to fully connected layer to make the final classification output layer. The output could be binary, which is normal electrocardiogram versus the abnormal electrocardiogram, or multi-class, which could determine the different types of heart conditions of a person. Now we'll go through the training and evaluation of the CNN model. The CNN model for electrocardiogram signal analysis is trained using labeled dataset of ECG recordings, where each signal is tagged with its corresponding diagnosis, example normal atrial or fibrillation. Training involves loss function. For binary classification, the most commonly used function is the binary cross entropy. This measures the difference between the predicted probability and the true label, giving us the value 0 or 1. The formula for binary cross entropy is given here, where n is the number of samples, p is the predicted value, and yi is the true label. When applying binary loss function on ECG dataset, the model's goal is to distinguish between an abnormal and a normal signal. Optimization. Optimization algorithms include stochastic gradient descent or ADAM, which are used to adjust the weights of CNN to minimize the loss function. Now we'll go. Evaluation metrics. The performance of the CNN is evaluated using metrics such as accuracy, sensitivity, and specificity, or the area under the curve. These are very important. Now we'll go through pre-processing and data augmentation for ECG. Pre-processing the ECG signal before feeding it to CNN is essential for optimal performance. Some common pre-processing steps include removal. ECG signals are often contaminated with noise from different sources such as muscle activity, power line interference, baseline interference. Filters like bandpass filters or wavelet-based denoising are applied to clean the signal. Segmentation. The ECG signal may be divided into individual heartbeats or shorter windows to focus the CNN on relevant parts of the signal. Now, normalization. The amplitude of the ECG signal may be normalized to have zero mean and unit variance. This helps in the model converge more efficiently. Data augmentation. Since labeled ECG data can be limited, data augmentation techniques such as random time shifts or scaling the signal are often applied to generate more training sets and prevent overfitting. Applications of CNN is in ECG analysis. Now, CNNs have been successfully applied in many areas of ECG signal analysis, including arrhythmia detection. CNNs can automatically detect abnormal heart rhythms such as atrial fibrillation, ventricular tachycardia, and more. Myocardial infarction detection. Certain patterns in ECG indicate myocardial infarction, and CNNs can identify these patterns. Heart rate variability. CNNs can be used to analyze variations in heart rate, which can be indicative of different heart conditions. And the last is patient monitoring. CNNs can be integrated into wearable devices or remote monitoring systems to continuously analyze ECG data and alert clinicians if any abnormal patterns are detected. Thank you for listening. That's all.